Hey guys, this is Megan. This is our week 2 April video, and this week we're talking about muscle strength. If you keep in mind that muscle mass is a concept of use it or lose it. It refers to maintaining your muscle mass at any age. After 40, we generally start losing our muscle mass, our metabolism slows down, which increases our weight gain. So if we can keep our muscle mass under control, that should help with some extra weight gain. Even if you're active cardiovascular wise, we want to make sure to not avoid that cardio, or that we want to maintain that cardio strength. So you may have to do some additional exercises to keep that core strengthened and those muscles intact, or that they're functioning at their best ability. So if we have less muscle mass, the things that can go along with that are more insulin resistance, which leads to type 2 diabetes, lower bone density, lower immunity, higher blood pressure, higher cholesterol, sleep problems, decrease in self-confidence, and an increased risk of depression. So you want to commit to 2 days a week of strength training to help keep that muscle mass intact and keep moving you forward. Think about strength training programs that use exercises that are multi-joint and multi-plane movement. Want to use barbells, not necessarily dumbbells, but using your own muscle strength or your own body strength to help with those muscles. Think about push-ups, chair dips, arm circles, lunges, squats, calf raises, and setups. The nice thing about all of those are things that you don't have to have any equipment for. You'll be able to do those on your own. You can do those in your office. You can do those at home. You can do those very easily, 2 to 3 times a week. Getting a little bit of that in, helping keep that core strengthened. And finally, thinking about dialing up your resistance. So think about increasing the weight or increasing the repetition on a weekly basis of any of those exercises will help keep your strength training up. So think about those areas to decrease those risk factors that we talked about earlier, the insulin resistance, the bone density, the immunity, cholesterol and blood pressure being elevated, and keeping that self-confidence high. Also help maintaining weight, especially for those that are over 40 or approaching 40. Any of us are getting older, so we want to make sure we do everything we can to help keep our body at the best shape that it can be. So anyway, just think about it 2 times a week at least for strength training, keep that muscle mass up. That's our video for this week. Also keep in mind that we'll be doing our screening on April 25th and 26th. You should have seen the flyer, and we'll be available from 7 to 9 in the Fegan Meeting Room. Show up, do your blood pressure, do your body mass index from the scale, do your blood pressure, get a little snack, and be on your way. So we'll make it as quick as we can possibly make it. That'll end our 2016-17 year and start our 2017-18 year. Thank you guys. See you later.